Of heroin in the tri-state, it's well documented. Now, just hours ago, President Trump announced opioids are a national public health emergency. The president says opioid overdoses now kill more people, that is, than traffic crashes and gun homicides combined. And he says the United States consumes more opioid pills per person than any other country in the world. The declaration gives the White House authority to focus on federal, state, and private resources. It will also allow patients to get treatment by phone instead of requiring in-person doctor visits. Government can hire more addiction specialists, and it taps a public health emergency fund. But that reportedly only has $57,000 in it. 9 on your side's Ashley Zilka is getting local reaction to the president's announcement today. Ashley?
Tanya, local advocates say the president's declaration is a promising first step. I spoke with one addiction specialist. He says it will give the tri-state access to resources that only the federal government can tap into.
Nobody has seen anything like what's going on now.
We just declared war on something, and it's going to be a long war.
You don't have to explain to Dr. Mike Kalfas how bad the opioid epidemic is. He's busy treating addicts every day.
There's enough voices that they have to be heard. You can't just ignore them.
He says a national public health emergency means more dollars locally.
Without money, you don't have treatment capacity. You don't have, you can't hire the people to help that you need to. You can't get facilities. You can't get beds when those are needed.
Money that hopefully will see results.
It's going to do more than simply just writing a check and waiting for someone to come up and snatch the check and trust that they're going to do the right thing with it. It's going to make this, everything's going to be done in the public eye and people are going to see it.
Kalfas says he hopes this fight doesn't stop here. He would even like to see a state of emergency declared, which is different than a public health emergency.
It's a little different. It throws in more resources. It throws in even more collaboration. You get law enforcement stopping the supply. You get education resources. You get everything in there. This is a great first step, but it shouldn't be our last step.
Today, the president also stressed the need for tougher drug enforcement for police. At least 64,000 Americans died from an opioid overdose in 2016. Tanya?
All right.